Hi, my name is Goldie Lesser, and I would like to be a student at the University of Western Alabama. I got my bachelor's degree at UCF, and I'd like to be a part of the clinical mental health track master's. So, I've got some questions that you're interested. So, why am I interested in this specific degree? Well, ever since I remember, I've always been helping out my family and friends with different situations that they've been dealing with, and I've always been interested in mental health and different disorders. And my passion stirred about when I guess my friends in middle school were having different problems with different traumas, and I would try to help them out. And I was like, how else can I help them out? So I got my psychology degree at UCF, and while getting my psychology degree at UCF, I interned for Choices of Mental Health in, I think Sanford. I think that's where it is. Anyways, I interned at Choices of Mental Health, and I worked with people with bipolar, people with ADHD, people with different psychiatric problems under the care of nurse practitioner, Nurse Caroline Stewart, between the year of 2018 and 2019. And what really drives me is I love helping people, and I like helping people in through their life decisions and through their courses. Also, when I was younger, I volunteered at Orlando Health, and I would help different people that came in to more adjust to the hospital and to the different crises because I volunteered in the emergency ward. So I want to become a therapist, so that is also why I'm interested in this specific degree. Is I want to do one-on-one counseling with people, especially in relaxation and dealing with stress in general. But I know a lot about schizophrenia and bipolar and severe developmental disorders. Now, during my bachelor's, I read a lot of my own about philosophy and Stoicism and Sigmund Freud. So I have a lot of knowledge in different psychological aspects and different teachers. I love philosophy, and that's also progresses my interest. So present your career objectives is what you asked me. How a degree in classing will prepare you to meet these objectives. Well, my career objective is to have my own practice, and I want to do something on my own that's like relaxation therapy for people. But that's something I still want this degree and what it's going towards. But I want to do something a little bit different, so I'm kind of like an innovator in that area. I think relaxation therapy is something that people should be doing, though I do know it's in clinical mental health and becoming a therapist. So becoming a therapist is my first step into getting into that career. And my career objective is to get my master's, to do the practicum and do the internship. And I'm just so fascinated by psychology. So my career objective is to get my master's and come into my own practice. That's my main goal. Describe your experiences with respect to cultural diversity. So while I was at UCF, I would meet up with different groups and learn about their cultural backgrounds. I love to go to like the Spanish club, or I like to go to Portuguese and learn about different cultures. And I've been fascinated by religions. I myself am agnostic, but I will sit down and pray with just about any other culture and like learn what they believe. So I just think it's important to know the other side of the spectrum, because as a therapist, sometimes we get stuck in our own world, but we have to have the ability to be able to switch and understand other people's perspectives and other people's walks of life. I think in high school, I wasn't a part of one group. I just went around to different groups, not because I didn't belong, but because I like knowing people. And I was a newscaster growing up ever since elementary, middle school, and high school. I was the news anchor for the school. So I would get to interact with a lot of different people. So I have a lot of experience with different backgrounds. Briefly discuss how you deal with stressful events. Now, when I dealt with stressful events when I was younger, I would be complacent, and then like feel my emotions and say something. Now I'm more technical with how I deal with my stressful events. So I usually deal with my stressful events because I know so much about psychology. Is I do meditation practices, I do breathing practices. I manage my time very well. So in stress, I usually keep quiet, listen to what's going on, and then decide what to do and what's the best course of action. I've never in my whole life been quick to anger or anything outrageous. I've always been very, even when I didn't know about psychology, very level headed. So, because I've been at the Orlando Health Emergency Ward, I've dealt with a lot of people who have been in crisis situations since I've been at the hospital and in Choices the Mental Health. So, I'm very good in crisis situations. I reside in Florida. And I think I've answered counseling credit at another institution. I don't have a counseling credit at another institution. During my bachelor's, I did do an internship in counseling under the guise of a nurse practitioner and learned about what she did, but I don't have any other counseling credits. So I hope you like me and I hope you accept me into your program. I am so thrilled if I'm accepted to your program. I would really love to be a part of your team and just keep on growing, keep on learning. Thank you.